Today, our guest is Dr. T.N. Sreedhara Kurup. He's very familiar for us for the last couple of days, a lot of days. He's with us and presenting a lot of topics as well as heavily, hectically active, participating in discussions and giving a lot of suggestions. Dr. T.N. Sreedhara Kurup is retired Assistant Director, Central Council for Research in Homeopathy, a legend from India with 46 years experience. The topic is homeopathic management of antenatal compliance.
First of all, I thank Almighty and especially our Master Hanuman, my pranams, and big tribute to our masters and especially our Dr. Christian Patrick Samuel Hanuman and my well wishers and my friends and IFPH, that authorities, that the office bearers. I like to extend my heartfelt warm regards to all of you to give me again one more opportunity to take a session here. That today's my subject is that during pregnancy some problems are there. That is called prenatal problems during pregnancy. The first thing, I am going to take headache. If there is time may permit, I may take that the anxiety and fear also. See, nowadays the pregnancy is one of the biggest problem. That earlier there was every 1 or 2 years there were children were coming, and every family there were plenty of children. But nowadays 1 or 2, in most of the time there is no children. That means sterility is the biggest problem nowadays. People are running here and there. The main cause is that late marriage. That I don't say that you must have to marry early, like that child marriage. I am not telling like that, but that if late marriage causes so many problems to becoming pregnant and becoming a mother, it is a dream of every person that to becoming a father or mother. People are very happy, but some cases it is a headache also, because the attitude of the people, that the parents and surroundings is taking a good circumstances is a very big cause for all these problems, because nowadays nuclear family, everyone is serving mainly the male and even female, that the both are serving. So there is a problem. Even they cannot meet each other. Recently, I treated a case from abroad. They are married last 6 years. The husband was having 36 years. The wife was having 30 years age, but married 6 years. But there is no even single contact, because the lady was suffering from that the dyspareunia with urinary tract infection. When she is having some desire, the husband is having sudden emission. Whenever she may start, that they may start that time itself sudden emission. So it was not possible. So they both got each other angry, and they were in the edge of to the divorce. That time they came for consultation, but that time, that particular moment, that I treated both of them, and the first time they met each other and they got the first contact, the first time, that time only. There are so many cases. We cannot. Recently, I treated one case, that one love marriage, the different communities, that boy was having the fear to marry because he was having sudden emission and he is telling there is no erection. Then I asked, how you came to know before marriage? He told that I tried several times to the masturbation and some other methods that he tried, he is not getting erection. I told you wait for, because his marriage was within 1 month. I told you wait and see that I told some of the methods that after that I asked that first few days he failed to have that sexual contact, but later he won, and then I asked that how you are? I am all right, okay. And now that first show, second show, third show, like that, which is going, both were very happy. So this is the thing that especially the um, husband and wife are both are in IT professions, they may not get time. And even that some other field also, they may not get time, because they sometimes what happens, they may not, one is having morning shift and another may have night shift, so they may not even able to meet each other. That is the problem. The another thing that I like to mention here, some of the few points that is regarding to the marriage, because we think that the pregnancy, that there it starts, that first that people will think that the delivery is the first, the childbirth, that is the time. No, it is the fertilization time that is the most important. That is why when old people sometimes to say that if something gone wrong in the habit of the children, instead of that making that it is better to plant something else, say they may say it is correct. The time up to the fertilization is the most important time. That first, that the ovum, that must be correct, and also the sperm, that the sperm is thousands and thousands of the sperms running in a race. It is coming, the first one and the best one only can enter the ovum, pierce the ovum, and that time itself, within moments, it will start multiplying into it to become a zygote, and later it will so many division sudden about 270 to 280 days it will take, and it will multiply and it become a fully fledged child. It is going to, so many changes will happen in the mother and the child, that it will happen so many hormonal and even to the so many other changes it will happen, that even the mother is also, of course it is a painful thing. So many things are painful, but they will enjoy that. Before, what I feel is that before becoming to marriage, don't see the horoscope. Some community, they will see the matching to the horoscope and so many other things, and status, jobs, and family background, etc. But no harm. But the most important is before marriage itself, if it is possible, they must have to see, check their blood, and if they have any anomalies, if any disease is suffering, they must have to first treat, and then they go to marriage. After marriage also, they must be, if there is any problem like that of any disease, what I mentioned earlier, there are chances of so many other diseases that we must have to correct, and after that, that a child may born, it will be very healthy. And even it is not possible, at least that they must have to take some treatment in our medicines. There are some soric, antisoric, antipsychotic, antisyphilitic, such medicine, anti-tubercular medicines are available, that according to the particular time, if it may give, we can correct. Even in during pregnancy, we can correct the dyscrasia of to the mother and the child. So that is we are having very good, wonderful remedies. So remedies we are having. So that we must have to treat according to that, and then only we must be. And another thing, even in late stage of pregnancies, if the presentations are not correct. Recently, I treated a case from Trivandrum. One lady doctor called me and she asked, "Sir, now only 2 weeks more, but last scanning, it is seems to be there is breech presentation. What can we do?" I told that give her 3 doses of 0/3 sulfur, and after that 2 doses of Parsatilla 1 But after that, giving that, within 1 week, the presentation become all right and a normal delivery was happened. After that, so many other doctors also asked me. I told them they also got the same result. So we are having no other system cannot claim like that we are having wonderful remedy during pregnancy, not even during pregnancy, becoming to pregnant in sterility in both male and female. We are having so many doctors, excellent doctors. I appreciate them. They have very good results in making even in Kerala government. There is some hospital clinics they started. Experts are there. About more than 1,500 children are still new comers came after the treatment of homeopathy. So it is a new field. So each one must have to try, and we must have to take risk and treat. And when they are not having that much result, but still they are taking risk and lot of money is spending. But in homeopathy, we don't want that much expenditure, but it is most effective also. But from there, I start that. So we must be very careful during first before pregnancy, when we must be very careful about the fertilization time. After that, even for that also, there is good timing is there. Not immediately after taking food, we must not have contact, but in early morning, that is called Brahma Muhurta. In old and ancient time, it is specially mentioned in some books. It is the best time, and that is the best time. And also, we must have to fertilization time. We must be very careful, and also we must be very healthy. Then only we will can have a good offspring and a good generation. We can. It is not only God is given these gender differences not only for enjoyment, it is for the existence of our life. That means future generation. So we must be very careful about the future generation. Then we can avoid so many so-called incurable diseases by birth, that is means congenital, by hereditary, that is the family history. Some of the families, some particular diseases are there, and also circumstances. These are the things we can find out. It is definitely have a big role in pregnancy. So now it is 15 minutes over, so that I like to come into the point that the some people, it is a headache, pregnancy is a headache because of the circumstances. But will you please screen share, please, our secretary, please? No. And
Yes.
some of the cases, that most of the people are happy. The family members are happy, mother is happy, father is happy, even there is siblings are there, they are very happy. But in some cases, it is a headache because of that. Regarding that, sometimes maybe fear, sometimes it may be due to anxiety, sometimes some hereditary factors, or sometimes it is some other problems. So I am going to say going to give some of the factors. Next slide, please. So headache, this is one of the major. Most of the people are having headache during pregnancy. Headache during pregnancy is one of the most common discomfort and complaints. Even once in a while, it is not there. Very rarely people are not having any problem. Most of the time there is sometimes some or the other problems will be there. There are more than 39 or 40 types of the complaints can come during the pregnancy or more than that. So headache may occur at any time during pregnancy, but tends to be most during the first and third trimesters. That is, first trimester and third trimester is the most of the time there is a headache is common. Next slide, please. Main causes of headache in pregnancy: increased level of progesterone during pregnancy, along with the increase in the blood volume circulating throughout the body. Second, physical and emotional stress. Sometimes what happened, these, of course, that progesterone level, that the all these estrogen and progesterone level may be decreased and increased. Due to that, the amenorrhea and the pregnancy may occur, and that is the main reason. But still, sometimes to the physical or emotional, because sometimes we may go to the outside, if we may go and exposure to sun rays, and even if it may can cause, or even wet weather, or wet in rain, and all these climate changes, or sometimes what happens, the emotional stress. Stress is one of the main factor. In olden days, the families were there, the elders will give comfort to the youngsters. See, this is the way to live after marriage, even delivery. They will tell, elders will tell mother, grandmother, and their sisters, and all they will help that to release the stress. Nowadays, the single family, that the nuclear family, they are not having time to talk, or they cannot share. All they are having, that their friend is now becoming to the mobile phones. They will chit chat, and only when they may get, and they will see there is no human relationship is lacking nowadays. That is one of the reason for the maximum stress. That is without stress. What is, you may ask a person, what is your problem? Most of the people will touch stress for what? In the office stress, family stress, everywhere there is stress. These six letters, stress is the one of the most important factors for so many diseases nowadays. Then next one is fatigue, lack of sleep. Because nowadays, today I asked one lady, came for medicine. I asked her, she was a teacher, and she told she will awake at 3:30. But when I asked, when you are going to sleep, 11:30. But she is not getting, because she is a teacher. She must have to go prepare food for the children, and prepare the food for the husband, and tiffin, and everything must be ready within 7 o'clock. So she must stay awake 3:30 or 4 o'clock. Then only the sleep was not sufficient. That she is having so many other problems started. So when I asked that, when she was so tired, only she can get to sleep during the holidays, only sufficient sleep. Next of the days, she is not getting sleep. Low blood sugar. During the pregnancy, because of the morning sickness and so many other problems, there may be that weakness, vomiting, etc. That due to the blood sugar can be low, or in some cases it can be high also. Next is muscle tension due to carrying excess weight from progressing pregnancy, high blood pressure, etc. So that the not only that, this first time that people are having more tensions, and they have that the muscular tensions and cramps, this, that, and so many other problems. And weight will be very high also. And some people may have high blood pressure. Even sometimes it can be low pressure also can happen, mostly in eclampsia. type of the diseases. Then next one is dehydration. If due to the vomiting and morning sickness, they may not take more. And also with the polyuria is the one of the major effect of this during to the pregnancy. The urine is passing several times, so the dehydration can occur. So they must have to drink more water, and especially that the Ganji water or to the that tender coconut and etc. or fruit juices they must have to take, not the sour fruit juices like that of lemon or that such sour fruits that we must not use. Then the other factors could be poor posture, change in vision, history of migraine, loud noise, big crowd, bad light, and polluted air, etc., etc., and similar unpleasant situation. Either that means that sometimes what happens, sometimes the nowadays, in olden days, what happened, the house, there was plenty of work that they must have to uh, take to the water from to the well, and they must have to grind these that for those hand, etc. Big stones were there, and also in that they were grinding the things. Now everything only in the fingertips. Everything in the life is becoming into fingertips. There is no exercise, lack of exercise, and they don't. In olden days, their ladies' duty is pregnant ladies' first duty is to clean to the surroundings up to the house with that the uh, that the broom. They will clean the surroundings up to the house. Nowadays, everything is doing for the job. Different people are appointed, so it is lack of these things. So there is no that. Then some hereditary changes like that, or disease like that, migraine, loud noise, because pollution is one of the most important, noise pollution and even air pollution, big crowds that whenever you may go Bombay like or Calcutta or Delhi or Madras, such cities, there is always crowd. Without crowd, you cannot sit, and there is sounds and etc. Even it is very near to a school, always children's noise are coming. The noise pollution is also, and also to the air pollution is also water pollution. All these things can cause that headache, bad light, and etc. Next one is a pregnant one presenting with headache. Take details history of the check. That before that also they may have that the same type of to the cases, pattern and amount of sleep. How much I told you yesterday that what the ladies are, especially during pregnancy, they need more sleep and rest. That usually they may not get it. That is one problem. Then second, level of physical and emotional stress that I already explained. The physical and emotional stress, fluid and food intake, more fluid and food when you may take more nuts and more nutritious food you must have to take. If it is required, that additional, that the vitamins and these minerals also you must have to take. For the surroundings at home and at workplace, such as pollution, excessive noise, would last too much light. Next one, history of migraine or recurrent headache before pregnancy. This also, when we may take to the case history, we must have to take all these points are very, very important. We must have to take for to the case record separately for to the pregnancy, and for such case record, we must have to prepare separately. During our study, the obstetric that cases, we must we went for to the examination with 20 or 30 case history, and we must have to present, then only we are able to. The same way, we must have to prepare a special case record for that, and in each type of the disease that it will be more convenient. Next one, any change in the vision. We must have to check every organ to organ, and especially the routine check. And along with that, the eyesight also we must have to check blood pressure, check blood sugar. The routine test first we must have to check, especially from the blood sugar and even blood pressure. Even that we must have to check to the thyroid. Test all these things. Tests are essential. Next slide, please. Solutions. One, physical and emotional stress, fatigue, lack of sleep. These are the first thing. If there is physical and emotional stress, fatigue, lack of sleep, advise patient to avoid stress, get plenty of rest, especially in dark and quiet surroundings. Practice relaxing technique, meditation, and deep breathing exercise. There are that we must have to do with the help of even yoga is also advisable, but you must have to consult a good yoga master. Otherwise, some of the posture cannot be advisable for that. And relaxing testing, quick relaxing testing, QRS is there. This quick relaxing testing, QRT, sorry, not QRS, QRT. It is a quick relaxing technique is there. If you are tired, you simply sit in a chair and sometimes and take deep breath and becoming to tight your body like this. Then relax for 5 to 10 times, you will get relaxed. And then if you want slow relaxation technique, you must have to lie in a bed and to think about from to the foot to head, that relax from each and every thing, and to slowly, just like that of that, savasana, like that of you must have to take and rest about 10 or 15 minutes, and you take rest, and then you will be more comfortable. 15 to 30 minutes you can take. Then next is low blood sugar. If there is hypoglycemia, advised to take frequent meals. Divided meals is more important during pregnancy. Two things, that it is they have some abdominal problems, that it can be correct, and more less food and different divided into 2 hourly or 3 hourly, they can take divided for the frequent times that they can do. So it will that reduce to the hypoglycemic condition, and that take plenty of water. Then 1 minute, because I cannot read like this, so that it is low blood sugar. I told poor posture. Poor posture, that is lie in straight way, or if it is not possible, their own way, according to homeopathy, that each person having their own position, it is better. But in advise women to practice good posture, give massage to shoulder and neck. If there is headache, it is better to give shoulder and head. This neck massage is always too good. Next one is dehydration. Next slide, please. Next slide. Hello. Next one is dehydration. Dehydration, advise women to increase fluid intake, that I already mentioned. They must have to take plenty of water. If there is no sugar or hyperglycemia is not there, they can go tender coconut or fruit juices, such things they can go. Otherwise, boiled water is the best one. Then next one is high blood pressure in eclampsia, pre-eclampsia. There is maybe usually high blood pressure. Sometimes blood pressure also can come. You must have to, if there is, you cannot control with the homeopathic medicine, you must have to refer the on hypersensitive disorders of pregnancy or management. If it is not possible, if you cannot control all these things, you must have, it is better to the patient to advise to a hospital or a specialist. Then frequent exposure to loud noise, big crowd, bad light, and polluted air, etc., and similar unpleasant situation. Advise patient to avoid such situations. It is better to such situations. It is, you must have to give a counseling. That counseling will always help that to the, and give the people to get relief, not only from anxiety, fear, and headache also. Their fear will go. Mainly it is due to the fear. They will get the headache mostly. Next one. Next slide, please. Hello. 7, history of migraine. We must have to inquire. Earlier also, sometimes what happened, the patient was having, I treated a case. I'm remembering one lady was having that. Then I asked that her history. She was having before marriage also, there was history of migraine. That I prescribed that giving vomiting was giving relief, right-sided. So I give sanguinaria syrup by 3 and it is completely cured. But that it was before also it was there. Sometimes during the time of pregnancy, some of the diseases can increase. That time we must give more care about them. Then advise patient to avoid taking things that trigger migraine, headaches like chocolate, alcohol, yogurt, peanuts, preserved meats, etc. Avoid stress, practice relaxing techniques, meditation, and deep breathing exercise, etc. Take sufficient rest and sleep. Always they must have to, when it is better to daytime also, one snap in the afternoon after taking meals, they must have to take some sleep, rest also, it is essential. Don't take so much hard work. It is better to avoid such hard work. And then muscle tension due to the carrying excess weight from progressing pregnancy. They may, day by day, their stomach, abdomen will increase, and then there will be, weight will increase, so it will be a problem. Muscular tension will be there. Then provide reassurance to the patient, advise women to practice. First, advise women to practice good posture, get shoulder and neck massage. This will always to help. And also we must have a very good that, advice and the counseling. There are nowadays, most of the hospitals, there are counseling people are, even in homeopathy, there are Sreedhara and such things are there. There is good counselors are available. These are all for these things. Now, very 2-3 cases. There are so many medicines are there. 10 to 12 medicines are there, but still I like to say very few cases that I got and I treated, and your cases I am going to explain. The first case is a case of, now how many minutes more? Hello?
8 minutes, sir. 8 minutes.
So 8 minutes what I can cover, that I shall cover that much. Okay. Because
Okay.
I have one more that anxiety and fear that I shall take in another day. Okay.
Yes, sir. Yes, of
But
course, sir.
but the content may be clear, and it is less content is far better, what I feel according to my experience in the last 2 years that I learned from the this IFPH. I learned that simply to giving so much pouring, there is no use. It must have to enter the mind of the people. Then only it is usable. Blah, 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 telling there is no use. That I also experienced myself, because I was a last 2 years I was a listener, more than that of the taking the class, so that I liked to share like that only. Headache during pregnancy. Case number 1. A lady aged 26 years was first 3 months pregnancy, suffering from headache during pregnancy, came for treatment. That her symptoms were that congestive headache with red face, throbbing headache with strong pulsation in carotid, violent shooting pain driving the patient, mild right-sided headache worse from slightest noise motion, light when lying down and bending forward, better by pressure, by wrapping, sitting erect and rest, boring up to the head into pillow, head to roll backwards and rolls from side to side. Rush of blood to the head, you may know the medicine now, because the all doctors are listening here, they can understand the medicine. So now some of the general indications. Now I gave already mentioned only particular symptom. Now general indications: sudden violent effect, flushed face, dryness, bright redness, burning heat, throbbing pain, pains appear and disappear suddenly, great intolerance of light and noise, and restlessness, sensitive and aroused. Manoj, will you able to tell the medicine? Because you are a very good doctor. That is why you are listening every day. Will you able to tell? It is well known as symptom. Most of the people will can throbbing pain and all these modalities you can understand. Now, how many times more? How many?
6 minutes, sir.
6 minutes. Then one more case I can explain. That another lady, a female patient aged 32, second pregnancy, 5th month, came for consultation. And the following symptoms were there: ailments from overwork and indigestion, headache, drawing, tearing, rapidly shifting, and accompanied with constant chillness, headache in warm, closed room, better in open air, and lying on painful side. Neuralgic pains commencing in right temporal region with lacrimation of affected site. That is the particular symptoms. That now that the general indications. Hot patient makes changeability, restlessness with dryness of mouth, tongue, spotted, yellow or white, tough. She feels chilly. She is better in open air, wears in the evening, desire for cheese, pungent things, and aversion to fatty food, meat, butter, bread, palm food, and drinks, and craving for ice cream, desire for company, mild, gentle, affectionate disposition. Parsatala 0/3 divided dose, completely cured her cases, divided dose for few doses for 1 or 2 days given, it is completely cured. Parsatala is telling that you cannot give during the time of only in the last stage, but it is possible to give. If it is needed, it can give in during the time of the pregnancy if it is indicated. Otherwise, don't give. And also that the lower potency, don't give any time. Higher potency, there is a chance of abortion. That I like to tell. Now another 3 or 4 minutes.
Yes.
So then I can tell the other medicines name only. One more case I shall tell. Another case number, a lady 33 years came for treatment for her 5th month pregnancy, history of repeated abortion, and headache involving right side and face with pain, pressing, bursting, bursts from motion, stooping, mental labor, better by external pressure, continued motion, headache with closeness of attacks, headache every morning with nausea, vertigo, and epistaxis, headache with great indolence, aversion to occupation, cannot assert thing, headache with falling of hair, chilly patient, predisposed to take cold at the change of weather, thin built with narrow pelvis, yellow saddle across nose, past history of repeated abortions. That is the one of the most important symptom of one medicine. Not only one, there are so many medicines. It is there, it is mentioned even in repertory also. But offense is set this here for vinegar, acid, pickles, and sour. But sour food aggravates aversion to food, sad, indifferent, even to loved ones, irritable. That now you got to the medicine, sepia syrup is cured completely. Now the time, how many? 1 or 2 minutes.
Yes, sir.
So that other medicines are chamomilla, bryonia, simicimuga, Gelsemium, Spigeria, and etc. Whatever you like, that according to the symptomatology and the constitution you can prescribe, you will get a very good result. Thank you very much for hearing me